Welcome everyone to an in-depth look at neovascular glaucoma, a serious and often challenging eye condition. In this video, we'll explore the causes, symptoms, diagnosis, and treatment options for this disease, aiming to provide a clear understanding of this complex ocular issue. Neovascular glaucoma at its core is typically triggered by conditions that cause poor blood flow to the retina. The most common culprit is diabetic retinopathy, particularly the proliferative type. Other potential causes include central retinal vein occlusion, carotid artery occlusive disease, and ocular ischemic syndrome. Essentially, any condition that leads to retinal ischemia can set the stage for neovascularization and subsequently, neovascular glaucoma. The pathophysiology of neovascular glaucoma is a cascade of events initiated by retinal ischemia. When the retina lacks sufficient oxygen, it releases a potent signaling molecule called vascular endothelial growth factor, or VEGF. VEGF stimulates the abnormal growth of new blood vessels, a process known as neovascularization. These new vessels sprout on the iris, a condition called rubeosus iritis, and in the angle between the iris and cornea, obstructing the outflow of aqueous humor, the fluid that maintains the eye's pressure. This obstruction leads to a buildup of pressure within the eye, resulting in glaucoma and potentially damaging the optic nerve. While precise epidemiological data can vary depending on the specific population studied, neovascular glaucoma is generally considered a relatively uncommon form of glaucoma. Its prevalence is closely linked to the prevalence of its underlying causes, such as diabetes and retinal vascular occlusions. Therefore, populations with higher rates of diabetes are likely to see a greater incidence of neovascular glaucoma. The signs and symptoms of neovascular glaucoma can range from mild discomfort to severe pain. In the early stages, you might experience blurry vision or redness in the eye. As the disease progresses and intraocular pressure increases, symptoms can become more pronounced. Severe eye pain, headache, nausea, and vomiting can occur. Visible signs may include the presence of new blood vessels on the iris and in the angle of the eye, detectable during an eye examination. It's crucial to seek immediate medical attention if you experience any of these symptoms, especially if you have a history of diabetes or other risk factors. Diagnosing neovascular glaucoma involves a comprehensive eye examination. Your ophthalmologist will assess your visual acuity, check your intraocular pressure using tonometry, and examine your iris and angle of the eye with gonioscopy to look for neovascularization. A slit lamp examination allows for detailed visualization of the eye's structures. Further tests, such as fluorescein angiography, can help assess the extent of retinal ischemia and neovascularization. Optical coherence tomography, or OCT, can evaluate optic nerve damage. Neovascular glaucoma doesn't typically have distinct subtypes, but it can be classified based on the stage of progression. It's often described as pre-neovascular glaucoma, characterized by the presence of underlying ischemic conditions but without visible neovascularization, and established neovascular glaucoma, where new vessels are clearly present and intraocular pressure is elevated. Treatment for neovascular glaucoma focuses on addressing both the underlying cause and the elevated intraocular pressure. Panretinal photocoagulation, or PRP, a laser treatment that targets the ischemic retina, is a cornerstone of treatment to reduce VEGF production. Anti-VEGF injections directly into the eye can also help regress neovascularization. To lower intraocular pressure, topical eye drops are often used. In more severe cases, surgical interventions like glaucoma drainage device implantation or cyclophotocoagulation may be necessary. It's important to understand that management often requires a multi-pronged approach tailored to the individual patient's condition. Preventing neovascular glaucoma centers on controlling the underlying risk factors. For individuals with diabetes, meticulous blood sugar management is paramount. Regular eye exams are essential for early detection of diabetic retinopathy and other potential causes of retinal ischemia. Early intervention with laser treatment or anti-VEGF injections can prevent the progression to neovascular glaucoma. Management of other vascular risk factors, such as high blood pressure and high cholesterol, is also crucial. The prognosis for neovascular glaucoma varies depending on the severity of the disease at the time of diagnosis and the effectiveness of treatment. Early detection and aggressive management can often preserve vision. However, if left untreated, neovascular glaucoma can lead to significant vision loss and even blindness. Ongoing research is exploring new anti-VEGF agents and improved surgical techniques to enhance treatment outcomes. Gene therapy approaches targeting VEGF production are also under investigation as potential future therapies. Furthermore, advances in imaging technologies are allowing for earlier and more accurate diagnosis, leading to more timely intervention and improved patient outcomes.